I'm Dr. Regina Will, Consultant Gastroenterologist and Clinical Lead Gastroenterology at King's College Hospital, London, Dubai. Colon cancer is between second and third most common cancer in the UAE, depending on gender. Everybody should be screened for colonic cancer beyond age of 45. The UAE guidelines do recommend to start at age 40, and it is covered for UAE nationals and for Dubai and UAE residents with a basic insurance. If a patient has risk factors, for example, a positive family history or a pre-existing inflammatory bowel disease or other condition which increases risk factors, then screening needs to start earlier accordingly. We should screen for colonic cancer because we can screen for colonic cancer. Most cancers develop very quickly out of normal tissue and we can maximum diagnose them early. With colonic cancer it is different. Colonic cancer develops out of a single cell and then it develops first a polyp. It develops a benign lesion, a small colonic polyp, which then slowly grows and grows and grows until much later, after undergoing further genetic changes, it develops into colonic cancer. This process takes more than 10 years, or about 10 years. This is a window of opportunity for us to find changes before colonic cancer develop. And this is a big difference between colonic cancer and the screening for other cancers, which in fact is early detection. In colonic cancer, we can find the lesions before they develop into colonic cancer. There are 3 different screening methods which are recommended. The most simple and most economical method is a stool test for occult blood, meaning the patient actually takes a stool sample, which then is sent to the laboratory, and in the laboratory we check if there is blood inside. That is done by adding antibodies which react to blood and which is a highly sensitive test. However, this test is going to be positive if there is already colonic cancer or an advanced polyp. So it tends to detect lesions which are a little bit more advanced than a colonoscopy. The second option is to do a colonoscopy, which is the gold standard, but is the worldwide recommendation in settings where there are not too many economic limitations.